This is Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan. So very nice case, 79-year-old patient who had a set of implants, just the one and only from 1982. So just to put it in perspective, this was 44 years ago, and this is like Ronald Reagan time, just so many, and this is the one and only set. So she comes to me with obviously the complaints, hard masses, if you will, on the chest, breast area. And as you will see, this is a complete N block, 1826, initials NH. N block, the gold standard. And as you can see, a lot of significant contouring done in order to basically remove what is this hard ball mass. Now this is a very tricky case in the sense that you can see some of these calcifications. It's a relatively small implant. It's like literally bunched up in a ball. Now as you will see, there are parts of it that were very tricky because what is this extravasation of this area right here. So I'm going to go ahead and dissect this out. As you can see, this is unhealthy tissue. So as I dissect this out, you will see this is a protuberance of a capsular tissue right here, and look at the way how it's bulging out. Now if someone's kind of fast forward trying to go through all of this, look at this. This is like a ball sticking out, and it doesn't take much to basically go ahead to cut into this. Continue to please film. Yeah. So as I dissect, look at this bulge right here. And again, going back to overall, you can see how this is protruding into someone who's kind of rushing through it. They can cut into it, and now the silicone will pour out. A lot of inflammation. Now, one thing I just want to mention, I just realized this, and this is extremely important. With my her initials are NA. NA, and this is where 1/8/2026 initials NA. And so, and again, very important to show and document for the other plastic surgeons that, you know, this is the case, kind of write down the details. Obviously, we can know a lot. There's only 2 cases that I'm doing today, but again, very important to be very detail oriented. Not the middle initial or anything, but the first and the last initial. No HIPAA violation. This is in consistency with the HIPAA rules. So again, going back to the point here, this is the bulge, very hard, indurated, inflamed tissue. Now this is what I'm going to do. I'm going to take the pleasure of cutting right through this just to show you if someone is speeding, rushing through the surgery, this bulge, this extravasation, we do not want it to spill out. So as you will see, if I cut it, you will see, look at that. We do not want this to spill into the chest, and that is the whole purpose behind, literally it's like molten honey. We don't want this to spill into the chest, and that's the whole surgery in itself. So I'm going to go ahead and cut this open and take the pleasure of cutting through this, because this is what I was dissecting all the way around. Who wants this in their chest? And I will tell you, there is unfortunately a lot of patients, I'll probably say millions out there, who have implants that are old. Remember, implants are not lifetime devices, and they do not know that they have ruptured implants, and this is what they're living with. And you know, this is not like but this is reality. And as you will see, if I invert this open, none of this spilled into the chest. And I am going to cut this open, because remember, these are hard masses that I've been dissecting around. Very hard, calcified. Look at the brown consistency on the inside. Again, all contained. None of this spilled into the chest. That's why N block is the key. In my practice, I always assume that the implants are ruptured. Now, just the fact that her implant is from 1982, almost 99.999% she was ruptured implant. And so as you can see, look, this is probably another extravasation. Probably happened in, this is the silicone granuloma right here, silicone granuloma. So ruptured silicone and the body in itself hit it, basically walled it off. And so overall, I'm gonna go ahead and stop here. And I'm gonna take my top glove off. Remember, all sterile glove. I'm gonna take cultures of the inside right here. Look at this brown area. So I'm gonna go ahead and take cultures of that. So I have a fresh pair of gloves, sterile for the left side. Again, end block, the gold standard, initials NA. And as you will see, so another, guess what? Same thing happening right here, right? Look at this bulge. Look at this bulge right here. It doesn't take much to cut into it. The other thing I want to highlight here is look at this tissue. This is bad. Look at the way it looks. It's, if I may compare, look at this. This is dusky yellow abnormal fat. And maybe this is healthier fat that I removed, but there's scar tissue. That's why I incorporated this. So look at the quality of this fatty tissue. This is abnormal. If I touch it, it's hard and nodular. And so again, I'm going to take the pleasure of cutting right through this again. And remember, I was dissecting around it. This is like a trap, if you will. And look at that. You don't want this to spill into the chest. And that is the whole essence and etiquette behind this end block dissection. The surgeon has to do it in a very thoughtful, systematic way. Now, guess what? I talked to a patient who had implants from 2019, and she had a ruptured implant. So it can happen. And look at the way the color and how the body in itself does a good job containing the badness. I'm going to go ahead and pull all of this out. I'm going to send this off to pathology as well. And you can see the inside, all contained, none of this spilled into the chest. Very hard shell, if you will. I'm going to go ahead and cut this right here. Very hard. Hard like a rock. No one should have to live with this hardness. And we appreciate this very nice patient from sharing her journey. Look at this mass right here. And this is what is grossly clinically consistent with the silicone granuloma. And look at this. None of this spilled into the chest. This was all contained badness. And look at this as I word this open. Look at this. So I'm going to get good representative cultures of this with my swab. And so the way I do it, just so that you know, imagine this is my swab. I'm going to go ahead and get cultures like this. So I get a good representative sample. And then we're going to put this into the culture swab for aerobic, anaerobic, and fungal. And so the microbiology will weigh in as well to make sure there is no bacterial contamination. Look at this implant compared to this one. This one had like a more of a molten effect, but certainly you can see, look how abnormal and disintegrated it looks. So there you have it. For this year, this is my 4th implant that I've removed that has been ruptured. And so as you will see, this is the same way how I have done it, not only in this nice patient, it's the 79-year-old. We do it consistently in the same fashion. No lift, no need for drains, twilight deep sedation, high definition pictures, videos of the chest wall, extremely important. And certainly this, but most importantly, the chest wall showing complete removal of the implant capsule, done in a very thoughtful, systematic way. Twilight deep sedation. You have cultures going to microbiology, pathology, aerobic pathology. You have CD30 analysis, ruling out the BIALCL, BIASCC, which is the breast implant associated squamous cell cancer, BI associated anaplastic large cell lymphoma. Very rare of rare, but still needs to be ruled out. She will get her implants back, and this is done consistently regardless of the age so that she gets the best surgery, no matter her age and comorbidities. Every patient in my practice gets a medical clearance prior to surgery, so we know her heart, basically the patient's heart is good, thyroid is good, and the rest of the numbers are good. And complete, comprehensive surgery, such that when we look back at it, the patient has the peace of mind. She got all of it removed and all of it tested, and this peace of mind as she sleeps tonight. She got the surgery that everyone deserves. This is Dr. Khan, Executive Plastic Surgeon.